Welcome everyone to our live Q&A with Toronto's Associate Medical Officer of Health. Dr. Vinita Dubey joins me again this week. Thank you for joining us, Doctor.
Of course.
My name is Dilshad Burman. I'm a writer and reporter for City and 680 News, and I will be moderating this chat today. Now, if you're new to this chat, we've been doing this for coming up on a year in April, actually. What we do is we collect questions from our viewers and listeners on social media. I collect them, and then we ask the doctor these questions in this short half-hour period that we have every week. If you haven't had a chance to submit your questions, you can still do so while we're live, just underneath this broadcast. Put them in, and we'll try to get to as many questions as we can. The more the merrier, but if we don't get to them, I will carry them over for next week, so you have to tune in next week as well. So doctor, let's get started. We have a ton of questions to get through already, and hopefully we'll get some live engagement as well. Are you ready to go?
Yeah, let's go.
Awesome. So let's start with Ronnie. What we're going to do is we're going to start with vaccine questions, and then we'll get to all the others because vaccines, again, still top of mind for everybody. So let's start with Ronnie. Ronnie asks, what happens if you don't receive the second dose of the vaccine? Because it's a 2-dose vaccine. Will the first dose still be effective to fight COVID?
We actually don't know. So we know that those who got the first dose, this is for the Pfizer and Moderna vaccine, most people got the second dose. And we know that that interval for getting that second dose is as long as 42 days. That's why you'll see that some places have said that you can wait up to 42 days to get your second dose. And that's based on a recommendation from the National Advisory Committee on Immunization that had a look at some of the data. That's why 42 days was picked. But beyond that, you don't know if you only had one dose, how long will your immunity last? Because the studies really showed that most people actually did get their second dose. And it was, the efficacy was about 94–95% with that second dose. Now, if you had one dose and you can't get the second dose because you had a severe reaction, well, you got one dose and it may provide good protection. We just don't know how long it might last.
And then what happens if you get the one dose and you had to wait longer than 42 days? Does that mean you have to get the first dose all over again?
No, there is no recommendation that you repeat the series. So if for whatever reason it took you longer than, usually we say 3 to 4 weeks, depending upon the vaccine, is what they used in the trials to get the second dose. Up to 42 days now can be recommended. And beyond that, you would just continue with your second dose, even if it was 2, 3, 4 months later, get your second dose and then your series would be completed. You would not restart the series.
Okay, that's good to know. And then Andrew has 2 questions. We'll start with the first. When I get the vaccine, why do I still have to wear a mask?
It's going to take time for everyone who's vaccinated to have protection, for the disease rates to come down. And so we don't want to now say, oh, you're vaccinated, you can take your mask off. We still don't know, even if you're vaccinated, whether you'll be able to maybe spread asymptomatic infection. We're still trying to answer that question. So until we really know for sure, and until we really see disease rates come down, wearing a mask is still a really, really important thing that we have to do. Hey, we know that masks work, right? And so let's not get rid of the interventions that still work, especially while we still have quite high disease rates.
Right, absolutely. Actually, we have a live question coming in right now from Greg on Facebook. They ask, do you have any guidance for folks that are HIV positive? I'm assuming when it comes to vaccines.
You can get the vaccine as long as you don't have a contraindication to an ingredient. Having stable HIV, not considered immune compromised, and you are okay with the Pfizer or Moderna vaccine.
Okay, excellent. That's a really good question there. And then let's go on to Andrew's second question. Will I be able to choose which vaccine I get?
I don't know. Right now, choice, and whether in the future there will be choice, I can't tell you. But right now, if you're in a long-term care home, it's whatever vaccine they have available, whether it's the Pfizer or Moderna. If you're getting it from a hospital because you're a healthcare worker, it's whatever is available. There really is no choice right now. Now, between the 2 vaccines that are available, Pfizer and Moderna, they're pretty identical. I mean, the efficacy is 94 versus 95%. The ingredients are almost the same. So, unless you were really allergic to that one extra ingredient in Moderna, I would say get either vaccine if you can.
Right. And actually, doctor, you just mentioned the ingredients of the vaccine. We do have a question I just want to see who asked it. Angelica said, could you tell us the components of the COVID-19 vaccine?
Sure. I think it's important to say what's not in the vaccine. There's no animal products. There's no antibiotics. There's no latex. There's no preservatives in the vaccine. So that's all really important because people have questions. It's not made from fetal cells either. What's in the vaccine is that messenger RNA, and then there are fats, salts, sugars, which it would be very rare to be allergic to those. Each vaccine has an ingredient called PEG, polyethylene glycol. If anyone's ever had, a lot of laxatives had it, colonoscopy preps have it, even a lot of the liquid medications have that in it. So that's a very common ingredient. And then the Moderna vaccine has tromethamine, which is a specific ingredient that is related to dyes, like IV dyes that are used in healthcare. And that's mostly what's in it and what's not in it. Very, very small list of ingredients.
Okay, perfect. So that clears that up. And then let's see. Doug has a question. So if the vaccine gives your immune system the memory to fight the infection later on, wouldn't the ones who have already recovered from COVID-19 have this same memory naturally and not need to get vaccinated?
Yeah, it's a good question, and it's a real stumper. Usually, for some viruses, if you have natural immunity, it will last you for the rest of your life. It's very rare to get measles twice or chickenpox twice because that natural immunity tends to be long-lasting. But what we're finding with COVID is you can actually get reinfected. Now, it is more rare, but there are definitely now a number of cases of people who have been reinfected. It may be because the COVID virus mutates. There are variants, and that may be why, even though you've had it, you're not protected into the future. For the vaccine, we'll have to see if the virus keeps changing. There could be a point at which the vaccine may need to be changed as well to adapt to the changing COVID virus, the same way we do for flu vaccine every year. And so that's why we still recommend it, even if you got COVID, to get vaccinated.
Okay. And then Nick has an interesting question because the vaccine is frozen currently, at least the Pfizer one. And so he asks, how does something that only works when it's frozen work when it gets into our bodies, since our bodies are not frozen? What's the difference when they're injected into us as opposed to when they are shipped to us?
Yeah, they're not even just frozen. They're like in a deep freeze. Like, I don't even know what a -70 feels like, right? I think the important point to know is one of the reasons why they're stored at such a cold, cool temperature, it's because there are no preservatives. Because of a lot of the things that are not in this vaccine, that's one of the reasons why it needs to be kept so cold, to keep that messenger RNA safe. That messenger RNA is really, really fussy, so to speak. And so by keeping it really cold, you're going to preserve it. It's really, the cold is kind of like a preservative. But before you give it, you actually have to thaw it. And so depending upon the vaccine, there are different ways to thaw it safely, either in a fridge or at room temperature. For the Pfizer, you actually add a bit of a liquid, a dilutant, before you actually pull out the vaccine. And so when you actually inject it, it's going to be pretty much at either 2 to 8 degrees or at room temperature for a short period of time before it's given to you.
And that's fine then. I think the question is, does it have to be frozen when it goes into your arm? So that short period when they thaw it and put it into your arm, that's okay. It's not going to invalidate the efficacy of the vaccine.
Yeah, it's not injected frozen. It's actually brought to room temperature or fridge temperature, and then it's injected at that state. And so it's well above 0 degrees before it's injected into your arm. It is a liquid, and so it's not a cold vaccine at all, or frozen when it's injected.
Okay. And then Maki has a question coming in live right now from Facebook. You just said it, but bears repeating. They ask, is there MRC-5 in it, aborted fetal cells and other DNA in the vaccine?
There's no. The answer is no to both of those.
Okay, perfect. And like you just mentioned, there are very few ingredients. The most common ones that are causing allergic reactions, if at all, is is the polyethylene glycol, you said.
The PEG, yes, exactly. But there's no animal cells, there's no human cells, there's that messenger RNA. I think it's worth stating that the messenger RNA actually doesn't come close to our DNA either. I know people wonder that. Will it then interfere with my DNA? Actually, while they sound similar, they're actually very different. And so the DNA is in the nucleus of your cells, and the messenger RNA goes nowhere near that. And so the messenger RNA is like a recipe, and it injects into your body. It's a recipe to produce a protein, which then produces antibodies. And once that messenger RNA doesn't stay in your body for more than days.
Right. Okay. Perfect. Yes, that's an important distinction, because a lot of people, when they hear RNA, they think DNA, and then there's that whole confusion and worry about it, for sure. Okay, let's move on to a couple of other questions that were submitted. Worried asks, when will kids get vaccinated? And on that note, then, can a child get the vaccine if they have asthma and kidney issues? That's a second question from Catherine.
So right now, the only vaccine we have that could go for children is Pfizer, which is from 16 and up. The Pfizer vaccine has been given to 12 to 15-year-olds. So that's one possibility. We're waiting for it to be licensed in children and more studies to be done in children to say that it can actually be given to children more regularly. I think then the question of, well, what if a child has a kidney disease or asthma? Again, we'll have to wait to see what the studies show and to see how it's licensed. But you can imagine it might be similar to an adult, where if you have asthma or you have kidney disease, you're safe to go ahead and get the vaccine as long as you don't have an allergy to any of the ingredients.
Right, absolutely. And then actually on that note, Pam and Cheryl actually have similar questions, so I'll just club them together. Can you take the vaccine if you have diabetes, thyroid issues, blood pressure issues, COPD?
Yes, 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 yes. No problem for any of those. None of those conditions are considered immunocompromising. So people who had chronic health conditions did get the vaccine. Now, I do want to say, even if you're immune compromised or have an autoimmune condition, you can still get the vaccine. The only thing is we just recommend that you talk to your doctor or healthcare provider beforehand to make sure, like, do you need to time when you get your medication to when you get the vaccine, and to have that conversation. But for people who had chronic health conditions that were stable, the vaccine was given to them.
Okay. And then I guess these are all related. So Mario submitted a question, and then we have another question coming in live from Sona. Similar questions. Mario says, are people who have allergies prohibited from taking the vaccine? And then can children with allergies take the vaccine? That's the one from Sona coming in live.
Yeah, so let's talk about allergies. So if you have an allergy to bees or pollen or eggs or foods, you can still be safely vaccinated. If you're really worried, like you have a history of anaphylaxis allergies, what it means is you could stay in the clinic for 30 minutes instead of 15 minutes just to watch for those side effects. But there's no contraindication. You don't even need additional precautions. The only allergies you have to worry about is if you have a specific allergy to the ingredients that are inside the vaccine. And that's that list that I told you. And really the most common one is that allergy to PEG. Now, people may say, I don't know if I have an allergy to PEG. And so part of the response is, well, have you ever had a laxative that has PEG? You probably have. Have you ever given, if you're worried about your child, a liquid Tylenol or Advil? That probably has PEG, or a liquid antihistamine, or that kind of thing. Even those, I've heard those easy swallow tabs or those gel caps have PEG in them. So usually people who have a PEG allergy are aware that they have one, and it's not the kind of thing that you wouldn't know about. And so really the people who should be, who need to consider their allergies are those who have those allergies to that very small list.
Okay, perfect. And then one more question about a pre-existing condition. Penny asks, if someone has MS, should they even consider taking the vaccine?
I would say yes. I mean, I think when you have a pre-existing condition, we found that people who have chronic health conditions, even something as simple as high blood pressure that may even be well controlled, or being obese, I mean, they're getting worse complications, more severe illness from COVID. And so being protected against COVID is certainly something that you would want to do.
Wonderful. And then let's see. Mary asks, Some people have had serious side effects after the COVID vaccine, like ITP or neuromuscular disorders. If people get side effects and it means that they lose their jobs and their livelihoods, is there any supportive compensation program by the government? Yeah, that's the question basically. We don't want to fall in that small percentage that has that bad reaction.
Yeah, so ITP is not is not one of those side effects that's been noted so far yet, as far as I'm aware, with the Pfizer Moderna vaccine. It is something that has been noted in other vaccines that children get, like the measles vaccine. That has been one of the things that children can get, but most often recover. But I think the point here is that should you get a rare side effect, and it debilitates your life. But we've heard that the federal government is putting together a national vaccine injury compensation program, which is needed, because if you don't know in advance what kind of reaction you're going to get, if you get one of those severe reactions and it's considered from the vaccine, there should be compensation coming for that.
Okay, good to know. Okay, and then Barb has more of a logistical question, I guess. She says, it would seem that a large number of people have only received one dose of the vaccine right now, and a large part of the supply that's coming in would be needed for those second doses. So so should we basically hold on to the vaccines that are coming in now for the second dose, or can we just, vaccinate everybody for the first dose and see what happens?
Yeah, so I think different places are doing things a bit differently. There's no question that to get that full protection, you need those 2 doses. And so if there are concerns about vaccine supply, it might be the better choice to make sure that you have a second dose that you can give within that 42-day window to people who were vaccinated with the first dose. This is really you got to look at the numbers. You got to look at the people that were vaccinated, how many second doses you need. I think some places have already kept the second dose. Yeah. Some have given them up and are now waiting for additional vaccine to be used for the second dose. So I think some of it varies on the logistics of the place, but there's no question that the recommendation is to give that second dose within 42 days. So between 3 to 6 weeks to plan for that second dose to be able to be given.
Right, absolutely. And then this last vaccine question, Ozge asks, what is the status of other vaccines approvals? It seems like Pfizer is not going to be able to keep up with demand.
So AstraZeneca is, we've heard, going to be, is being looked at by Health Canada for approval. So that's one that may be coming in Canada. There are a bunch of other, if you actually look at the list, there's about a dozen or so other vaccine candidates that are in the near or far horizon for COVID vaccines. So I think it's fair to say it's not just going to be Pfizer and Moderna that will be approved. And so we'll have to wait and see.
Absolutely. Okay, so we've come to the end of vaccine questions for now. The rest of the questions this week were a real mixed bag, lots of different topics to cover. So let's jump in. Hami asks, private schools have continued to stay open. Private religious LTC homes have underreported COVID cases, he says, in the second wave. Churches and mosques have stayed open. What more can public health do to get the serious message across about COVID infections and variants?
Okay, so let's talk about schools first. The schools that are open are only allowed to be open if they're providing special education to a specific group of students. So that's the only kind of in-person schooling that's allowed right now in Toronto or the GTA areas. Religious institutions are allowed to be open for 10, a service, a rite, a ceremony of up to 10 people per service, rite, or ceremony. And so some religious schools may be providing a religious service up to 10, but that's all they can provide. They cannot be teaching math or English or anything else during that time frame. And then in terms of the long-term care homes, the private long-term care homes, so every time a test is done, it's automatically reported to the health unit. So like a private long-term care home in Toronto, if there's a positive, it gets reported to Toronto Public Health. And so there are also public health. We have investigators that are involved with each of the long-term care homes and retirement homes. So hopefully people are being tested as they need to be tested. There's that interaction between public health so that the reporting of cases really, you need to, as long as they're tested, they will be reported to be able to make sure that it's not missed. That will be the case.
Right. And then coming back to the question, though, what more can public health do to get the serious message across? Because we've got variants now, we've got higher spread. What more can public health do, or what can we expect?
Right. So what we are seeing, it was hard to believe, right, around Christmas time, but what we are seeing is that the stay-at-home orders are working. We're actually seeing the numbers decline. They are still high from a community transmission perspective compared to where we were in September, but they're certainly much better than we were around the holiday season. So that's one thing. And so I think what we need to realize is the public health measures do work. And so that's what we can do more of. And I think as we think about the variant, what we need to do is, if we're wearing our mask, wear it properly, make sure there's no gaps, not under our nose, wear it at all times. Don't take that chance of that small 2-minute conversation with someone without wearing masks. That might be enough with the variant to get infected. We don't know, but what we do know is that the public health measures that we have, we need to use them properly and to the best that we can to be able to prevent additional spread. And I think right now we have to continue with the stay-at-home orders because we need to still get the cases down even still more.
Absolutely. Doctor, you were saying, compared to the holidays, of course, our cases have dropped even in recent weeks. We've gone from 4,000 down to like 1,800. That's great. But have we peaked yet? Has the second wave peaked? Do we know that yet?
We only know that you've peaked once you've seen it. You really can't tell. I mean, is it going down and staying down, or is it down and it's going to go back up? I think part of that is related to our own behaviors. We've seen that very well. And so if we can continue to do what we're doing, we can see this second wave decline, and be done with. But if we don't, if all of a sudden we start mingling more, breaking the orders, then we will see a rise in cases again, and it could be a double peak. Right,
absolutely. Okay, let's move on to more questions from people that submitted over the week. This is about schools. Concerned asks, COVID-19 cases have skyrocketed after children went back to school in September. And if children are contracting COVID-19 at school, perhaps not even exhibiting symptoms and bringing it back home to spread to the families, is it wise to reopen schools at this point because we're still in the grips of this second wave?
Yeah, so this is a question of chicken or egg, like what caused what? Was it going back to schools that caused the rise in cases, or were the cases rising whether or not kids were in school? And I think, I actually think it's the latter. I think cases were actually on their way up. Schools opened. What we found was that in schools, cases in schools are really related to what's going on in the community. But if there is a case in the school, not every case in the school is going to spread in that school environment. And so I think what we saw is those layers of public health measures that we had in schools helped to keep the spread in schools lower. So I think when we have lower community transmission, we'll have less cases in schools, we'll have less spread in schools. That being said, even when cases were high, like, in Toronto, cases were still high in December, even before going into the holidays, cases in schools by comparison were low. And we did do testing around schools. We did added testing around, if there was a case in a school, the classroom, sometimes the school. And while we found a few more cases, we didn't necessarily find proportionally a lot more cases. And so that suggests as well too that the cases that we're seeing in schools are more related to the community rather than actually being spread within the classroom setting, for example.
Okay. And then I think the question that most people say is then why even bother taking that little bit of risk? Why would we bother opening schools at all? Because it's still, even though it's lesser in proportion and all of that, it's still spreading. It's still moving around in the schools. So why is it so important to keep the schools open?
Well, I think schools, I mean, I think we have to balance and look at, what are the rates and what can we do in schools. We actually know that we can do a lot in schools to keep the spread of COVID down. And it's more than just about testing. It's also about, wearing the mask, staying home when you're sick, doing screening and all of that stuff. So, but we know that schools are really important for children. I mean, the mental health questions, concerns between parents and their children are increasing as more time is spent while children are not going to school, especially some children really need to go to school. As my colleagues say, school is essential work for children. And so I think that's the balance, nothing is without risk, but we need to be able to balance the needs of children to be able to learn in that classroom setting, especially for some of them.
Right, absolutely. So we have a live question coming in now, actually, and we had this a lot early on in the pandemic. Bears repeating. Amy asks, I quarantine my dry grocery goods for 7 to 14 days after I buy them. I'm curious to know how long the virus lives on surfaces such as grocery packaging when we keep them in the refrigerator and freezer.
Okay, so we usually say up to 72 hours. It's probably actually less than that, that the virus can live on things like packaging. We still use that more conservative 72 hours for things like, textbooks if students are returning things at school, or library books, for equipment as well that can't be sanitized. That's what our recommendation is at Toronto Public Health. But I think for you, when you're doing your groceries, I mean, if it's stuff that you need to eat, go ahead and eat it. You don't need to wipe it down. Just wash your hands before and after you use it. And then, clean the counter after you've put your groceries away as well.
Okay. And that's been the recommendation really from the beginning. I think we've been hearing that over and over ever since the pandemic started. So, but good to repeat always. Okay, let's go back to the submitted questions. We have a little more time here. D asks, is the new variant from the UK more contagious in school-aged children?
So that was what was coming out in the news early on. I've heard from my public health colleagues that have done some analysis on this that does not seem to be the case anymore, that it doesn't seem to be more transmissible among children. I think in general, it's a more transmissible virus, 30 to 50% more transmissible. So it's not specific to children, and so it's everyone. Everyone can transmit it more if they have it.
Okay. And then this is good to know, actually. I don't think we've ever actually gone over it. Swat asks, how do you treat yourself for COVID-19 mild symptoms at home?
Well, if you have a fever, you can treat the fever. You drink fluids so that you don't get dehydrated. You get plenty of rest as well. Make sure that someone is there to check on you, because we do know that you can actually get sick quite quickly with COVID. Sometimes having a check-in. I mean, there are a lot of virtual walk-in doctors. Even I know at the emergency department where I work at, there's a virtual ER as well, where you can check in as well too. And what I would say is, if you're not sure, you have a cough that's worsening, you can't catch your breath, or you're just not sure, I would say go seek medical attention. Don't delay.
Okay. And so most of the times it's treating the symptoms similar to like a cold, drink lots of fluids, get lots of rest, that kind of thing.
Yeah, there's nothing specific about, you can't go out and buy an antibiotic or an antiviral medication to help treat the COVID. Yeah, exactly. It's about getting over the symptoms pretty much.
Right. Okay. And then Ahmed asks, could you please elaborate on herd immunity, and at what point will Ontario have this kind of herd immunity?
So herd immunity is when most of the people in a population are vaccinated, and they act like a wall. And so that way, if the virus tries to come into the community, if enough people are vaccinated, it won't break through the wall. That's the concept behind it. Now, each virus has a different level of protection that they need. And so the most contagious virus, something like measles, might need more than 95% herd immunity in order to be able to prevent the virus from coming through. Something like COVID, I've heard different statistics, 70%, 80%, 85%. I'm not quite sure that we know exactly what the levels are. I think once we reach the levels and we start to see a big improvement, we'll know then. But essentially, it is definitely more than 50% before we can hope for that. Now, we can actually look at long-term care homes, and maybe in a little bit of time we might have a bit of understanding, because now 93% of residents in city-run long-term care homes are vaccinated with the first dose, and so maybe we might be able to see some early signs of herd immunity in that environment that might be able to help us understand this a bit better as well.
Okay. We have a very interesting live question coming in right now from Misty, and this is not one that we've addressed before. They asked, can COVID-19 cause menstruation disruption, like prolonged periods or maybe more than one cycle per month?
Yeah, so that's a good question. I mean, I think we're still learning about what COVID-19 can and can't do. I haven't heard that it can be related to gynecological issues like that. And so I would say if you got COVID and now you're noticing this, I would follow up with your doctor on that.
Right, absolutely. Okay, let's. We've got a little more time, so we'll go through a couple more of the submitted questions here. Shailendra is one of our regular contributors. He asks, was the 6-foot physical distancing sort of recommended by the World Health Organization? And if so, how did they know that maintaining that 6-foot distance will have less of an impact on COVID on others?
Yeah, so the 6-foot distance, or the 2 meters, is based on what we think, if you were to sneeze, how long would that droplet of sneeze fall? And that's where that distance came from. If you're talking to someone, how far do you have to be before you can be sure that if they're talking, their droplets are not going to fall on us? Mm-hmm. So, but I think as we learn more about the variant, I've heard people question, is 6 foot enough? 6 foot with a mask probably will be enough, but we'll have to determine that. The other question is, with the aerosols, we know that some of the tiny, tiny particles can stay in the air for a bit longer. And so while the 6 foot is really important, so is that ventilation, to make sure that those tiny aerosols don't creep into the 6 feet, don't travel, and so that they get dissipated as well.
Right, absolutely. And then here's a follow-up question. If everyone in a home is COVID positive, can they use the same toothpaste in the house, as the toothpaste might come in contact with the toothbrushes and, cross-contamination and all of that?
So I think the important principle here is infection prevention and control. And so as much as you can, you want to try and figure out how you can limit spreading the virus from one person to another. And so, that's why we say as much as you can, if you have a separate bathroom. If you don't have a separate bathroom, have a separate towel, a separate toothbrush, even separate toothpaste if you can, right? Because what you want to be able to do is to reduce the risk as much as possible.
Absolutely. And then let's round off with this last question. I think, we have about a minute left. Marjorie asks, can I wear my mask without a filter, providing it has 2 layers, because the filters are affecting my breathing?
Yeah, so we're recommending right now 2 or more layers. And that filter layer, again, sometimes you have to figure out what filter layer works well for you. A paper towel, a coffee filter, even cut to make a filter layer, or the ones that you can buy. If you can't tolerate that, the better mask is the mask that you can tolerate. Like, that's the first thing. Sometimes then, if you can tolerate a 3rd cotton layer, well, every additional layer of fabric that you can tolerate is going to be able to prevent those particles from escaping from the mask. But the most important thing, I still think, is that you have a mask that's comfortable and that you'll keep on, that you won't, try and open the sides to breathe from, because when you open the sides, that air comes out and it's not filtered through the mask at all.
Yeah, absolutely. I think the point is something is better than nothing. So put something on, 2 layers, 3 layers, whatever works, whatever helps you breathe and still protects yourself and others, right?
That's right. Yeah.
Okay, so we actually have another question coming in from Amy now, but we have run out of time. I apologize, Amy. We'll try and get to your question next week. It is now 1:01 and we have to let the doctor go. So thank you again so much, doctor, for all of this insight. And we look forward to chatting with you next week.
Okay, thanks. Bye.
Thanks to everybody that participated. Bye-bye.